Hey, everybody. Fascinating chat today, diving into the world of digital health and patient monitoring and so many more interesting topics with an innovator in the field from Vytrak. Zach, how are you?
Good, good. How are you guys doing?
Hi,
We're doing great.
very
Thanks so
well.
much for joining.
For
Really
having
intrigued by you and the team and the mission. Maybe start with some introductions on your personal journey to Vytrak and what's the mission? What's the big idea?
awesome. I think my journey flows really well into the mission at Vytrak. Um, so my career in healthcare started when I was about 8 years old. I was doing a pulmonary lung function test, and turns out that I had the lungs of an 84-year-old female. I tested out of the male category somehow. It was that bad. So growing up with asthma and lungs that bad, I was in tons and tons of clinical trials for all these experimental drugs and things that were coming out. So I got a very unique view into healthcare from a pretty young age. From there, I got just obsessed with all the different ways that healthcare moves. So eventually I became a trauma medic out in Los Angeles and got a whole other view from there. Decided I wanted to be a physician. Eventually in medical school, this is where the Vytrak journey really began, is the way that they teach in a lot of medical schools is they do what's called case-based learning. So case-based learning, what they do is they treat you as a detective and they'll say, here, solve this case. And you get up and you present it to the class. So it became a running joke every day, either before I would present a case or a classmate would, I would have the same exact question every single day in med school. And it was this. It was, how did the patient get this bad? How? This is their third diabetic ulcer. This is their fourth heart attack, right? The only reason these things are happening is because we're doing entirely reactive care. We're just reacting to however sick the patient is when they finally feel horrible enough, show up in our doctor's offices or our ERs. And I couldn't stop thinking about this just broken, constant reactivity we had in healthcare. And I started to wonder if there was a better solution out there, something where, in fact, we could be much more proactive with our care. If we could figure out this amazing technology where we'd be able to pinpoint the moment somebody's healthcare goes in a direction we don't like, intervene there. Imagine the amount of lives we could save, the amount of cost we would reduce for a health system, and even with now Medicare and CPT codes and almost any PPO, actually generate entire streams of revenue for providers. So while I was in med school, I dropped out in order to start Vytrak and actually work on what that solution ended up being, which is today Vytrak, and now bringing that solution to anybody anywhere on the planet, regardless of chronic condition, level of technology literacy, whether you have a smartphone, don't have a smartphone, have Wi-Fi, don't have Wi-Fi, it doesn't matter, because the core premise for us is we now know 6 years of doing Vytrak, this technology always saves lives, always reduce costs, always is going to even in some cases generate revenue. What's our responsibility to provide this to everybody, no matter who you are, what you look like, where you are? So that's been our core focus really since day one at Vytrak.
Wow. Wonderful mission. Irma, do you want to open up with any initial questions, thoughts?
Yeah, I was going to say it's a fantastic story. And one of the things I love so much about talking to entrepreneurs like yourself, basically on a daily basis, is how often what they do in the world now, helping others, has a personal story attached to it, has got that component of why they first got passionate about it, whether that was because of their own experience of the healthcare system or that of their loved one. So we would love to dive into all the details about your solutions. And we know remote patient monitoring is one of them. So tell us how your solution is different from others, or perhaps goes further than some of the other options out there.
Awesome. Yeah, it's interesting you said, because at Vytrak, we've been having a lot of conversations about no longer describing ourselves as an RPM company, right? I think that very much pigeonholes you into, we gather a vital sign and we trigger an alert. That is not what we are at Vytrak. That is certainly a piece of what we do, but we like to think of ourselves more as a proactive health company, right? A care collaboration company. Because it's not just about pinpointing, okay, this trend of alerts have come in and figuring out that moment. It's also about answering the question of what now, right? What do you do with that? The thousands, millions, if not billions of data points that are coming at you. How do you have a system that's going to help you triage that, get to the most important thing you need to deal with first, right? So understanding not just access to care from a patient's perspective, how can we make care delivery more accessible from the other side of it? So a few things that differentiate us. I'll start on the patient side. Number one is access to care. That's been our focus since day one. How we do that is by meeting every patient where they are. So I'll paint a picture for you, a quick spectrum, right? Mm-hmm. Let's say we've got quite an elderly patient, right? And in that situation, I often see maybe this patient has a smartphone, but they're never keeping up with it, right? Or to take it a step further, they may have no smartphone or a computer at home, or to take that a step further, they may not even have Wi-Fi, right? So no smartphone, no Wi-Fi. How do I still get data from this patient? All the way to the other end of a spectrum, you might have a patient who's a little bit younger, more tech savvy, wants the most cutting edge ways that exist to monitor their vitals and get in touch with their provider. It's not the same solution for everybody across the spectrum. In fact, there are very different solutions for very different kinds of humans who happen to be patients. So on one end of the spectrum, let's talk about the really elderly patient with no Wi-Fi, no computer, no smartphone. We use 4G enabled devices. What that looks like is you actually take a SIM card, like the one inside of your cell phone, and you embed it in a medical device, a piece of hardware, a blood pressure cuff, a weight scale, a thermometer, glucometer, all the ometers, right? And with that, this elderly person does not need to scan a QR code, get on the internet, do anything. They literally just use the device by pressing a button. As long as they have 1 bar of LTE cell service, which is most of the country, that device will go straight to a satellite down to the provider's dashboard, coded as green, yellow, red. All the way across the spectrum to, of course, the Bluetooth devices, all the wearables, the Fitbits, the Apple Watch, Oura Rings, you name it. We connect to something like over 50 types of devices. But all the way to the very other end of the spectrum, we have the ability to gather vital signs from a patient just using a smartphone camera. By just holding up your smartphone camera to your face for about 45 seconds, we can get a heart rate, a pulse ox, a respiratory rate, a blood pressure now, which is pretty new, and even a stress level. So the stress level one actually has opened up a whole new world for us because we're no longer just looking at how a chronic condition affects a patient physiologically. Now we can actually look at how a chronic condition is affecting a patient's mental wellness. Because that stress level is not just how happy or sad you look when you're doing the reading. It's taking your HRV, the time in between your heartbeats, and a calculation with your heart rate, how fast that heart is beating, and a calculation with your respiratory pattern to give us an actual data point for your mental wellness. So now we can see beyond diagnosis, we can now also look at prognosis. So I have a little brother who recently diagnosed with diabetes, and everything changed for him beyond just the actual diagnosis. What does it mean to go to a buffet for the first time and choose different foods, to go to a party and go in the corner and have to inject yourself with insulin? These changes in your life have true effects. And if we can measure them and intervene and respond based on them, maybe we suggest therapy, psychiatry, psychology, different kinds of therapies than we would traditionally. I think that helps us take a true look at a whole patient rather than a symptom or a diagnosis.
Wow, wonderful approach. And you mentioned all this data you're collecting from patients. How do you use AI to help those caregivers, doctors with real-time insights or predictive health? I mean, what is your approach?
Great question. So AI is, I want to be careful because it's a very ubiquitous term out there right now. It is more of a term. I would say 90% of the time when you're hearing about AI, mostly what you're actually hearing is large language models and machine learning, right? Hyper complex if-then engines that are taking into account tons and tons of factors. That's different than what AI is. So what we're doing is we're utilizing large language models and machine learning to do what exactly? Great question, right? When an alert comes in, of the tons and tons of alerts that are coming into your system on a given day, and here's something that I think is really interesting because I personally see a gap in the industry forming, a huge gap that almost nobody is addressing. Is as we see health systems and physicians and a lot of healthcare move to a more proactive approach, what does that mean? Tons and tons of more data. That data that we're gathering from these patients are only useful based on our interaction with it, based on our response to the data. So what we're developing at Vytrak are algorithms, large language models, and things to actually take those millions and billions of data points and answer 3 questions. What's the first data point you need to deal with? Suggesting what you should do with that data point based on age, background, demographic, chronic condition, tech literacy, all those different factors. And then from that, tracking the whole life cycle of that data point until it's quote unquote completed or finished. So from the provider side, our goal is to actually create healthcare at the click of a button, right? Solve it one at a time. So we'll give you the 5 or 6 things our system will allow you to do, for example, in response to a red alert blood pressure or a yellow alert from a questionnaire, but also using those models to suggest what you might want to do in response. Obviously not diagnosing. I know for some reason, and I can't wrap my head around this, 99% of healthcare innovation is going directly toward diagnosis, which the one thing that I've learned is doctors and nurses don't hate anything more than when you tell them how to do their job. They hate it. If you tell a doctor, here's the patient's diagnosis, on my software, they're just going to hate you immediately out of habit or instinct. We're focusing not on diagnostic efficiency. We're focusing on workflow efficiency, which is a very different thing.
Oh yeah, workflow is one of those key words in healthcare because with such overload and burnout already existing in the healthcare system on the provider side, last thing you want is to give them some amazing technology that's just going to disrupt their workflow and make their work even harder. So clearly, you keep that in mind. Now, back to the patient side of things.
Sure.
So clearly, to have all that data that you can then analyze and provide those actionable insights, you need patient participation and patient engagement. So you've already started talking about how you meet patients where they are. So that's very important. But how do you actually get them to use this technology? Do you train them on using this? Is it on the providers to get them started with this? Like, talk about this aspect of patient engagement.
When I first started getting really involved with the software and the technical side, and now knowing enough to be dangerous when working with developers, there's a saying that developers have, which is the right technology is the technology you use.
Exactly.
And that's something we think about at Vytrak all the time, right? You could have the best, the flashiest. We talk about always building a better mousetrap. But at the end of the day, the right technology is the technology that somebody uses. So the way I think that we historically have gotten our adherence numbers for patients to a higher level than I would say is standard at all within the industry is 2 things. Is number one, like we mentioned, it's figuring out the right thing for that patient, right? If I put a technology burden on a patient they can't handle, it'll never work. So something that we've been experiencing at Vytrak is we go to these large health systems and I say, hey, we've got amazing solutions for you. And they say, yeah, we tried it, doesn't work. And I say, can I guess what happened? Can I assume what the model was we're trying to make work? And they go, sure. Say, let me guess, this is what happened. Some big fancy company in our space with a name that is beyond recognizable came to you and said, hey, we do it. What did they do? They sent a box of devices to an elderly patient's house. That, first of all, getting 1 device, let alone 5, it's never going to happen. And then you ask that patient to understand how to link Bluetooth devices to a central hub that is then going to transmit their readings to the hospital. And it never made it out of the box. Is that what happened? Yeah, that's what happened. Cool. Let me explain to you how we're going to do this differently. We're going to create different programs for your different patients based on their population and based on their technology literacy, right? And the fact that we can gather a lot of data just from a smartphone means we can get a lot more nimble with the kind of devices we deploy to the patient, right? So we have heart failure programs, for example, where we give a patient a 4G enabled device, but also an app. Now we're gathering 5 or 6 vital signs from a patient just by sending them 1 weight scale. But on top of that, our algorithms will automatically, based on certain vital readings, put you into a questionnaire to get us more information, automatically push you a piece of education, help us avoid a hospital readmission. So from that perspective, I think number one is meeting the patient where they are. But the other thing you asked about is the training, right? When I was trained to become a medic out in LA, I remember we had this guy, he was a veteran, he was in the military, fought in Kabul, Blackwater. This was one of those really hardcore guys. And he had this mentality that I think is emblematic of what is the way military teach. It's a process of see one, do one, teach one. And that was how our entire medic training went. You saw somebody do it, you would do it yourself, and then you would teach them how to do it. Anytime where Vytrak is involved in the training of patients and getting them to understand the program and the why, we always do the method of see one, do one, teach one, right? So you see us, right? Here's how we do it. Here's how you take your blood pressure. Here's how to use the app. Now you do it, and we watch them do it. And I go, okay, I actually have no idea what any of this stuff is. Can you teach me how to do it? Until they can teach it back to me, you don't let that patient go home, right? You don't let them leave, because what's really important is at the end of the day, this is truly life-saving technology. And we have so much data at this point, so many stories I can tell you from doctors and health systems calling us saying, this patient would have died, right? They were going in a horrible direction. And we caught this early enough to change a Lasix, to bring them into the office, to tell them to self-admit to a hospital, right? Those data points are so important that it is worth every moment of sitting with that patient and making it important to them. And I think a lot of other companies miss that as well.
Wow, really well said. So let's talk about how you scale up in our very large and fragmented healthcare system. You got, small clinics, huge hospitals. How do you think about going to market and meeting the different needs of all of these healthcare providers, and what's the challenge there that you kind of have to overcome?
So there, our advisors over the years at Vytrak have kind of changed their tune a little bit when it comes to the type of business that we take on at Vytrak. At first, they were very much pick your niche, do diabetes really well, right? Do hypertension really well, do heart failure really well. And I just kept thinking the reason that I left medical school was to try and save as many lives as I could. I realized with one good deal at Vytrak, I could save more lives than I could in 5 lifetimes as a practicing physician, right? So it always felt too narrow. I wanted to affect macro systems rather than an individual chronic condition. So over the years, I eventually got them to come around to my way of thinking, which was this. Any health system that is providing any level of reactive care, if I can change that to proactive care, that's a type of client that I want. So our clients look very different. Everything from your classic health system to your private practice physician, but we also do a lot of work with school districts. We also do a lot of work with the houseless community or those experiencing houselessness. So we're not afraid of different verticals. And how are we able to meet the needs of all these verticals? To your question is, all these verticals have very different needs, right? When I go to a health system, I say, all right, well, what do you already have in place to get in touch with a patient, to teach them something, to do follow-up care? Usually there's a nurse navigation team, which is colloquially at every health system, they have one of these. They have social workers that are already going to patients' houses. All we do is we figure out what workflows are already in place and how do we just change them slightly so we're not interrupting the system. And then for physician offices, every single one is its own use case. I've never met 2 physicians' offices that are like, if you're going to be successful at a physician's office, you got to get in the weeds. You got to learn the politics between the MAs and how everything operates and who's responsible for what. So that takes a little bit more time. But if you show these physicians' offices and health systems that you're willing to create an entirely customized program for their needs, that's a client that's going to stay with you no matter what.
Wow. So you've already told us a bit of a success story. I would love to hear maybe another one where you take us end to end. You mentioned how your solutions literally save lives. Would you give us one example of someone that we can kind of picture in our mind of how it made a difference in their life?
Yeah, so I can tell you war stories about Vytraks here, but I'll give you one that for whatever reason is sticking out to me right now in this moment. I was invited to go to the Clinton Foundation's Global Health Initiative. And there you have the best and brightest, all of these incredible people. The Queen of Jordan is there. Like you have some pretty amazing people at these conventions. And every year there's a different theme that they focus on. And last year when I went, the theme that they focused on was maternal health, what they call the 4th trimester. And there's a huge disparity across the country between the death rates of Black mothers and white mothers. Huge, something like I think it's 9 times across the country, 13 times in New York. And I'm sitting at this panel. It's with, I think it was like J.B. Pritzker, and I think it was the African American Mayors Association, and Secretary Clinton was up there. And they're going on and on about how horrible the disparity in the death rates are and why that might be. And I'm sitting in the audience going, I can tell you exactly why that is. We're watching white mothers much more than Black mothers. We're watching them much more closely. The only these death rates are happening is because they leave the hospital and we cross our fingers and say, hope they'll be okay. That's why. We did a study with a hospital. I don't think I'm allowed to disclose which one, but they're one of the larger systems. And what we did was a study of 60 mothers, and we looked at postnatal hypertension, right? So the usual readmission rate for postnatal hypertension, I think, is around 60%. In our study, and all we did was give these mothers a blood pressure cuff where they could take their vital readings. And based on those vital readings, a PA and an NP would monitor them and call the patient and make changes. Usually, hey, change a dose of Lasix and record all these things. Throughout our study, of the 60 mothers, we had 0 readmissions. Not one.
Wow.
And I'll tell you why. Because it's not rocket science, right? Blood pressure doesn't go out of control like in a day, in an hour, in a moment. The way blood pressure works, right, is you've got a normal healthy valve that's open, and slowly that builds up over time. You can catch that moment that buildup first starts. That's a yellow alert, right? If I can catch you there, we're doing really well. And there, if I'm usually patients are coming in and feeling symptoms like here, right? That's the problem. So if I just give you some really solid ways to catch those moments, we're always going to provide better care. So I think for us, that was really telling, is because that's a direct way to see some good that we've done. And we're working with a lot of these systems to try and just, this is one of the most frustrating things about having a solution like ours, is we just want to shout from the rooftops as much as we can. We can save lives. We can help you. Whatever problems you're dealing with as a health system, the solution is here, and the solution is not rocket science, right? It's if we our patients more closely, if we give true well care, proactive care, we'll always save more lives and we'll always give better care. And the fact that it's here and it exists in such an incredible cutting edge way, what's our responsibility as providers of healthcare, as patients, to demand this, to change the level of care that we experience as a standard, right? So if you go on our website at Vytrak, the first thing you'll see, and this is something we truly believe, is the standard of care has changed. And I think that begs a lot of very interesting questions.
Wow. So I think I might know the answer to this question, but I want to ask it anyway. So let's talk about the future of healthcare. It looks like you're already kind of bringing that into the present. So, but I want to hear your words. What changes in healthcare do you think we'll see over the next few years? And how is Vytrak getting ready to perhaps champion them, or at least embrace them?
It's interesting because there's a side of me that is super optimistic, and another side of me that has been kind of in the trenches for the last few years in healthcare from so many different perspectives. So I'll give you my very optimistic approach. And to Medicare's credit, right? Medicare has a lot of problems, but also does some things that are really great for patient care. So the only reason I was able to start Vytrak, I had this vision in medical school where I said, I can give amazing proactive care to patients. And everybody I called who I respect in the industry all had the same question. You can guess what that question is. Who's going to pay for this? And I said, well, people will pay for it because it's the right thing to do. And I eventually learned that is not a reasonable answer. Medicare in November 2019, all of a sudden decided to prioritize, with some of the most lucrative CPT codes they put out in a very long time, remote proactive care. So they put out a whole new set of codes called the RPM CPT codes. And those reimburse at about $120 per patient per month. We go to some really rural communities where doctors are maybe making $100,000 a year. In those communities, we can say to a physician, if you have 500 patients to put on our program, that's an added $250,000 in revenue per year. Your patient satisfaction go through the roof. You're going to save lives. You're going to change what I do, just as a tangent here. Anytime before I go into a physician's office, and this is really boots on the ground, I'd go on Yelp and I'd see what their score was. I'd read all their comments. And the comments are almost always this: the waiting times, and the doctor took 2 hours to do this and that. I look 6 months after Vytrak starts, and it's completely different. It's the doctor cares about what happens to me outside of the office. The doctor, when I come in, he has my blood pressure readings ready to go. I'll tell you a story, which I love. One doctor says to me, go on a visit, doing a client checkup. Doctor says, you want to see something really cool? I said, sure. He goes, all right, I'm about to take you into the room with me. This patient is going to immediately complain about the medication I put them on. I'm telling you that right now, and just watch this. I said, okay. I go into the room during the visit. I'm standing in the corner, and the patient right away, like clockwork, starts complaining about his medication. And the doctor pulls out a chart, all his Vytrak blood pressure readings. And what do you see? Green, 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 yellow, 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 red, the peak. He goes, change your blood pressure. He said about 2 weeks ago. He goes, I can tell you the exact date right there. And he points to the highest red peak. That's when I changed your medication. And now look, red, red, yellow, 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 green, 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 green. And the patient went, oh my God, I can see what the medication is actually doing to my health. Now he's one of his most compliant patients. It's that easy. I think patients just want to know why you're doing what you're doing and provide them some evidence. It's right there. Show them. You can prove why your healthcare is actually objectively getting better or worse. So I think it's fun to ponder all of the different applications of what you can do. But I think, to go back to your question of where do I see the industry going, more of this, more and more proactive care, more and more data that's happening every day, that this is the only sustainable path forward. And then for us knowing that, it's okay, well, how are we going to handle all that data? And that's what we're currently focusing most of our innovation on at Vytrak.
Wow, wonderful
Oh.
anecdote. What a great story. So final question here. I'm a bit of a wireless tech geek.
Yeah.
And it seems your approach really allows you to support many different countries and regions with embedded wireless technology, standardized. Is that something you're planning? Is entering all these markets and reaching patients globally?
So I'm a huge tech geek. So it's everything from wearables to all these different things. So I'm also looking at things that are starting to be developed. So right now, as long as you are anywhere on the planet with 1 bar of LTE cell service, I can get a Vytrak from you. It does not matter where. There are parts of the world that don't even have access to that. So I spent a lot of time for a few months out in Uganda. We were out in the bush, and I worked there with a doctor who was the only doctor for hundreds of miles around. So you would have a line at this guy's door every day from people who'd walked miles to get healthcare from somebody. And I remember thinking one day I'd love to solve that issue, right? If I can really touch through rural healthcare across the world. And right now, what they're working on, which is really cool, it's not ready yet, is the ability to, if you think about data, right? Average data, it's almost like you're sending a full airplane suitcase, not a carry-on, right? To get data from one place to another. And the way that data travels is you have to have enough space for that suitcase to pass through to get onto the airplane to get where it needs to go. So what they're working on now is you don't always need a full suitcase, right? A lot of times we're just putting in the suitcase a small little cube or a small little, I don't know, maybe a one t-shirt. You don't need for one t-shirt. So they're actually working now on ways to make it so you can actually send a very small parcel, the size of a letter, through the waves to get it onto the airplane instead of a giant suitcase. So you can get that to anywhere in the world. As that technology moves further and further, we can get vitals from any place on the planet, almost regardless of level of cell signal. As long as there's cell signal within a certain amount of miles from where that individual is, we may be able to piggyback off of that and get it up to the satellite down to a dashboard. Once we have that discrete piece of data, we can do anything with it, right? We can code it for alerts. We can triage it. We can suggest workflows based on it, based on the region. So there's a lot of really cool things happening in terms of health tech. And I see new things every day. I'll just leave you with a few things that I've seen coming down the pipeline that we're currently integrating with. I think which should be available for beta test in a month is the ability to cough into your iPhone microphone and suggest a band of likeliness of what respiratory condition you may be going through, right? So we're just trying to think about all the different kinds of technology someone may interface with at any point in their day. How can I get more health data, more information to try and figure out, is there something going wrong that I can fix? We're also using even the iPhone camera beyond gathering vitals, taking a picture of something on your skin and giving you a band of likeliness of what dermatological condition. So really trying to use everything we have at our disposal to gather health data from. And with all that data, right, that data, what's important about good data is the story that it tells. So trying to pull those stories and the narrative from that data, that's how you save lives.
Wow, fantastic. What an incredible mic drop moment. Well, we'll wrap up on that very optimistic and exciting note. What are you up to the rest of this year? You must be out and about at meetings and gatherings, events, conferences. What's on your radar for the next couple of months?
Never stops. I joke that I love living in Philadelphia, but I actually joke that I live on an airplane. So I'm back and forth all the time, conventions, meetings. People just want to be in person now. And I think one of my biggest takeaways post-COVID is what takes me 6 months to a year in Zoom meetings, I can do in 2 in-person meetings. I think people want that again. So a lot more client-facing, being there, being present. And for me, it's always been, even during COVID, no matter who we onboard as a client, I'm there on the ground with the medical assistants. I'm there during patient onboarding and triage for weeks at a time. You can understand from up here, right? You have to get down here with every client to understand. And now that I think we're starting to normalize that a little bit more, I'm looking forward to this year doing a lot more of those patient-facing experiences, getting back to really understanding on the ground where healthcare is and taking those insights and using them to create some amazing technology that hopefully I'll have some more news about the next time we do an interview.
Fantastic.
Great feedback loop there for sure.
Congratulations, and we're all rooting for you, and we'll meet you in person, either in Philadelphia or Boston or wherever that we'll find ourselves out of the marketplace. Thanks, Zach. Thanks for joining.
Thanks for having me, guys. Thank you so much.
Zach.
All right. And thanks, everyone, for listening and watching. Reach out to Vytrak and follow the amazing work they're doing. Thanks so much.